All right. Hello, everyone, and welcome to our Wellness Speaker Series, where our goal is to become informed and educated about many different forms of wellness. And today we are highlighting Dr. Summer Nicole Radina, and she currently resides in Kauai. And so by the power of Zoom, we are able to connect no matter where we are in the world, which is super awesome. She and I have never actually met in person. I was referred to Dr. Summer from a client who found phenomenal results with her core work, which is not like any core work I had ever done. I had touched on a little bit
for 2 weeks in. Oh, okay.
Sorry, I'm gonna mute those two. With my MELT method education, but certainly not in this way. It's very comprehensive, all-encompassing the pelvic floor, the diaphragm, the core, self-massage, breathing techniques, and so I just immediately fell in love with it. And I'm still myself trying to figure it out because I have had such an athletic life, being an athlete, a trainer, and thinking I had a very strong core. It really turned me upside down in a good way, because I realized that my super strong core has probably been working against me for a long time. Personally, I think my super strong core has created some shoulder dysfunction. So this will all make sense to you as to how that could be once Dr. Summer started speaking. And so she's going to take us through kind of a mini overview. She does these courses, these 4-week online courses, and there is one going to be coming up here soon in June. And so I'll have all the information to share with you that I'm going to drop into the chat box. At the end, we'll leave some time to discuss any questions that you have. But again, if you want to check out that link, it'll lead you to a couple different things, which she will explain at the end. For those of you who don't know me, I am Stacy Fisher. Sorry. Some of you, I have some unfamiliar names who've popped in here, so thank you for joining us. My business is Fisher Fitness, and I am a health and wellness fitness coach in Wilson, Wyoming. And if you'd like to be invited to future speaker series, go ahead and visit fisherfitness.com, and you can pop your name and your email into the pop-up box, and you'll be invited to future calls. So I am going to pass the torch now to Dr. Summer, and one second. Okay, you're up.
Aloha, everybody. My name is Dr. Summer Nicole. I'll just give you a little snippet of my background, where I'm coming from with all of this. My doctorate's in physical therapy, and let's see, I graduated in 2006, and I've always considered myself a very non-traditional physical therapist, and specialize in craniosacral therapy and somato-emotional release and energy work and fascial work. And was really, like, before I got into low pressure fitness a couple years ago, I was like really on like the emotional side of things, and how the emotions like manifest in the physical body, and how to like get to the root of those, and inner child work and all of those things. But when I found low pressure fitness, it was literally a level 1 teacher had moved to Kauai, who started dating my friend. And she's like, have you heard of hypopressive breathing before? And I was like, no. And she's like, let's do a trade. I was like, great. And so we did a trade. And as soon as she started doing all the assessments to me that you guys will get it's one of the videos in the free gift, these 3 self-assessments. As soon as she started doing those to me, I was like, oh, I could feel how tight my diaphragm was, and how tight my upper abdominals were from the 20 years, of traditional core work and yoga, Pilates, that type of stuff. And I could tell, like, through those tests, my abdominals and my pelvic floor weren't functioning the way they're meant to. And so Yeah, it really and because and once you guys we'll start talking about the concept of low pressure fitness and hypopressive training. Once what I find with most people is that they'll get the concept. They're like, oh yeah, that makes sense. Like, we're decreasing pressure. Got it. But once you kind of come into the practice of it, there's like a 1 to 3 week neuromuscular rewiring period, I call it, to retrain your body to breathe and hold its posture in this way. And so it's really I'll start with and Stacey, you just interrupt me if you have a question or you want me to clarify something, okay? But with I'll start with just hypopressive breathing. We'll start with that. So hypo means low. So hypopressive means low pressure breathing. That was a technique that was originally started by a gynecologist, actually helping women postpartum with diastasis recti and incontinence and uterine prolapse and bladder prolapse and things like that. And then you'll see it in if any of you guys have ever seen those old pictures of Arnold Schwarzenegger in his weight training days, like his show days, where the stomach looks really sucked in. It's like this, he's actually doing the abdominal vacuum technique, which in low pressure they call apnea. And because it reduces the waistline and it makes the ribs broader and it makes you a little bit taller. And so they do that to kind of get that stature in the pictures. And then it really wasn't until 2006, I believe it was, that it started to be used in more of a clinical setting, therapy settings. And then it wasn't until 2014 that low pressure fitness was created. So low pressure fitness is the company or the brand, you could say, where they took the hypopressive breathing technique and they pair it with these specific exercises or postures and they've created pelvic floor restoration programs, core and pelvic floor restoration programs. And there's 3 levels, and most people just take 6 to 12 months to work on level 1, basically, because it is quite a bit of just retraining. Because what happens with, and we'll just kind of jump right into what you guys probably know of sort of old school traditional core training, and sort of this paradigm shift to hypopressive training, which is in traditional core work, it's very much, it increases intra-abdominal pressure. So think about your traditional crunch, right? Where the rectus abdominis, that superficial abdominal muscle, is shortening and contracting. Planks, supine leg lifts, jumping, running, all of those things increase intra-abdominal pressure. And so you do a ton of traditional core work, and even somebody that looks like they have the washboard, 6-pack abs, it's actually not very healthy, and it's not very functional either. It's you just do 100 crunches a day, like a lot of people do actually. It just makes for a short, tight, a short, tight abdominal wall. And then you're just strong in that one direction, and what happens over time, and this can come from other things too, childhood trauma, poor posture, bad, not good spinal mobility or rib mobility. But what happens over time is that from all those crunches, this part right here, the upper abdominals, the rectus abdominis, that knits the ribs together. And you can think of those cues that you often hear in exercise classes: knit the ribs, draw the belly up and in, right? Those types of cues, they all create this brace, right? And what happens is it pulls the ribs together. And so then when we go to breathe over time, when that gets stuck in that position, the diaphragm becomes very tight, the upper abdominals become very tight. And then when we're breathing, our ribs aren't able to fully expand because that myofascial tissue is so tight, holding the ribs together, right? And so if you think about a tight diaphragm and a tight abdominal wall, what happens over time is that it's this steady kind of increase of intra-abdominal pressure. And what happens is that the diaphragm pushes down on the abdominal contents, the abdominal contents push down on the pelvic organs, and then the pelvic organs push down on the pelvic floor. And so then the pelvic floor is then weighted, or you could say loaded, by the pelvic organs. And what happens for most people is that it becomes very tight. the pelvic floor, because it's like going like this, like trying to hold up the weight of like bladder or uterus or, so it's, there's sort of a misconception that like, oh, all pelvic floors are weak and we need to do Kegels. But really it's more about like, well, what's the load on the pelvic floor that's creating this tension because it's trying not to let any of your organs drop out of you. Even if you don't have full-blown incontinence, like this was me, I didn't have full-blown incontinence, but I had to pee frequently. And when I did go to urinate, I didn't like void all the way. Like 5 or 10 minutes later, I have to pee again. 5 minutes later, I have to pee again. I'm like, I feels like I have 3 small bladders. Like, why is that, And what I learned was that even though I didn't have full-blown incontinence, it was a sign that my bladder was sitting too low. And what happens when the bladder's sitting too low, it can kink the urethra. And then that's what creates that frequency and then not being able to void all the way. So that's one piece. So that your body has like warning signs, just like some of you may feel. A really common one is like pressure, heaviness in the pelvic floor, right? Like that's the really common symptom that most people feel, like just a heaviness. So, so that's what, if you're just doing traditional core work that increases intra-abdominal pressure, then you're eventually going to have this downward force on the pelvic floor. Okay. So that's like traditional core work 101. Okay. So jumping to like this paradigm shift of hypopressive training. And I'm going to stop kind of in the middle of these two things, because in physical therapy school, what we were taught, and it's what we were taught in low pressure fitness as well, that the way the deep core is supposed to function is 2 ways: synergistically, meaning all at once, and then reflexively, meaning involuntarily. It should turn on for you a split second without you having to think about it, before your bigger muscles do your like gross movement. Okay. So synergistically and reflexively, that's how the deep core is meant to function. Okay. So also when you've had an injury, if you've had any type of injury, low back, pelvis, hips, whatever, anything around that area, the deep core gets inhibited. It's called neurological inhibition. And whenever the deep core gets inhibited, it's like it shuts off and it doesn't just naturally come back online. We have to specifically train it to come back online. So you look at people, just yogis, for example, seen so many yogis over the years, that they have an injury and then they think their yoga practice is going to get them healthy again. And it's like this crucial piece of rehab of actually turning on the deep core is skipped over. So then when they go to their yoga practice, think of like standing poses, right? Like Warrior Two, these big gross movements, right? Then if the deep core isn't working the way it's meant to, then all your bigger muscles are going to overcompensate and try to do that work for those deep stabilizers. So this is why people's low back paraspinals get really tight. Their hip flexors get really tight, their hip rotators or glutes get really tight. Like all these like bigger muscles start to try to do that work for them. So, so that was taught in physical therapy school and in low pressure fitness. I just want to clarify that. It's just that in physical therapy school, when they took it to the practical level of therapeutic exercise was, here's dead bug to turn on transversus abdominis. Here's, opposite arm and leg on all fours to turn on multifidus. Here's what a Kegel looks like to turn on the pelvic floor. It's like, if you think about it, that's a miss, because that's turning it on consciously and actively, right? And that's actually not how the core is meant to turn on for you. It's meant to turn on for you reflexively. I didn't catch that for, years, decades, even almost, I would say, up until 2 years ago, really. I just didn't know to think any different. And then once I learned low pressure, I was like, oh, like it just clicked, where I was like, this is actually the magic of the method, is that, and this is what the research has shown, is that with this method, the transversus abdominis, that corset-like muscle, the deepest abdominal muscle, and the pelvic floor actually hypertrophy with this method, with hypopressive training, meaning thickens, grows, strengthens with this method. So I got real interested at that point, because I'd had 30 plus strains on my right hip flexor, like a lot, like an abnormal amount, and SI joint, instability and hypermobility and all these low back I'd had a pretty severe low back injury. So I'd have these things that like, I did everything I freaking knew and just nothing was working. And so I just wanted to speak to that piece because it's really a huge piece of why this method works, is that it turns on the deep core the way it's meant to function. So you skip to like the paradigm shift, and I can stop. Does anyone have any questions so far? I know this is kind of like a lot to take in, and I was just speaking, so let me just pause. Does anyone have any questions about anything so far?
And if you guys do have questions, you can unmute yourself and or drop it in the chat and I can ask it for you.
I just want to point out that since Stacy's recording this, I will probably be listening to this another 1 or 2 times. So, so carry on.
Okay, yeah, and let me know if I'm talking too fast or if you need clarification on something, I can say it in a different way. Just raise a hand. I'll look out for that.
Okay.
Okay. Everyone else is good?
Good.
Okay. So, so jumping to this paradigm shift into hypopressive training. So if you look at, this is what traditional core work does. It increases intra-abdominal pressure and it puts downward force on the pelvic floor, right? The hypopressive training does the opposite. Okay, so it reduces pressure, hence low pressure fitness or hypopressive low pressure breathing. It reduces pressure in the thoracic, the abdominal, and the pelvic cavities. And how it does that, and you're going to get in the free gift, it'll take you to a page on my website where you'll enter your email, and then there's a video for the self-assessments, and then the second video is the basics of the breath. I'm going to speak to it a little bit here, and you're welcome to kind of breathe as I'm talking about it right here, but you can go into it in more depth in that video. So the reason it works, let me give you just kind of like the structure of why it works, is the inhale is in the rib cage, expanding the rib cage wide. So we're so used to, how many times have you been taught to belly breathe, right? And if you belly breathe, and I'm not against belly breathing in supine, because you can really relax the pelvic floor on the inhale with belly breathing, and I think it's really healthy. But if you have any type of pelvic floor dysfunction or core dysfunction, it can aggravate. Okay. So, and I just wanted to, let me speak to this and give you, actually, before I go into this, I have one more thing I want to share. Think about this. All of your abdominal contents are surrounded by this membrane or lining called your peritoneum. And you have this like law of pressure that says, okay, think of that peritoneum like a balloon. That says, if I push on the top of that balloon, then, you know, all sides of that balloon are going to have equal pressure on it, right? Make sense? So think about any condition. So just speaking to like, what do I mean when I say core and pelvic floor dysfunction? Think about any conditions where things are bulging out, okay? So in the front, that's going to look like a hernia or diastasis recti, where the midline of the abdominal splits. Happens a lot in pregnant women, but men with a big belly can get it too. Prolapse, you know, where the uterus or the bladder is going downward, bulging downward. Disc herniations, backwards, right? Hemorrhoids. So it's like wherever your weak link is in your body, you know, is like if you have too much intra-abdominal pressure, something's going to go, something's going to give, you know? So that's what I mean. I just wanted to speak to that before going further. It's like if I say core pelvic floor dysfunction, think of any of those symptoms, any of those conditions or symptoms that you would have from those. So, so that peritoneum, if I push on the top of that balloon, just the weak link, wherever it might be, down out your vaginal wall, it might be a hernia, it might be the other way, you know, in the back, that's what I mean. It's like that pressure's got to go somewhere. And so what hypopressive training does is reverses that pressure. It decreases pressure in the thoracic, abdominal, and pelvic cavities. Okay, so it reverses that pressure. That's a main part of it, and it reverses pressure. And that's, I feel like, the conceptual piece that most people are like, oh yeah, that makes sense, right? Like, this causes too much pressure, this decreases pressure. You have to decrease the pressure in order to take the load off of the pelvic floor, because if the pelvic floor is loaded, it's tight, you know, it's not going to be able to fully relax or contract until you take that load off. right? So that's kind of the definition of a pelvic floor dysfunction, or can be, is like, oh, the pelvic floor is neither able to fully relax or fully contract. And so think about, I just want to speak to Kegels for a moment. So our whole fitness industry, Kegels, gynecologists, Kegels, postpartum, Kegels. If you have this condition happening and things are sitting too low and your pelvic floor is already tight, trying to hold up, you know, this weight, then you add Kegels to it. Kegels are like, I'll give you the analogy my level 1 low pressure fitness teacher gave me. She said, let's say you want, you know, a healthy pelvic floor to be at the hotel lobby. And it's so tight that it's stuck between like the first and second floor. And then you're told to do Kegels, you know, contracting the pelvic floor, or mula bandha in yoga. And that's all you're doing is contracting that already tight pelvic floor in that short, tight range. Make sense? Same with adding like a yoni egg. Why are you going to add, you know, resistance to something that's already tight? You know, and I'm okay with yoni egg stuff supine if you have pelvic floor stuff going on, but there's just stuff to think about, like stuff to really question, like in the how we're taught, like normal fitness, you know, that's good. And so, and then just also just thinking about, well, would I want to turn on the Kegel actively and consciously with the, you know, or turn on the pelvic floor with the Kegel actively and consciously, or can I breathe in a certain way and hold my posture in a certain way that will turn on the pelvic floor and the deep core for me? Because that's how it's meant to function, right? It's meant to function reflexively. So, does that make any sense? Okay. So with hypopressive training, with hypopressive breathing, and this is what you'll get in that video, is the inhale, instead of in the belly, like we're so taught often, is wide into the rib cage. Because if we have downward force already on the pelvic floor, and we're doing belly breathing all day and standing, that's gonna put more downward force on the pelvic floor. Okay, so so on the inhale, the inhale is into the ribs to expand the ribs laterally. Expand the ribs as wide as you can out to the side. So this way. Okay. The exhale is like a slow, quiet exhale. Your mouth is half open, your jaw is soft, like you're fogging a mirror. Very, very slow, okay? Without, and this is the key, contracting rectus abdominis, right? So this is what takes, in my experience, 2 to 3 weeks to unravel, is to be able to inhale and specifically exhale, keeping the rectus abdominis out of it. Because if I go, you can feel that in yourself, that's going to knit the ribs together. It's going to pull the ribs in because it's contracting the rectus abs. The rectus abs helps us exhale. That's part of its job. However, if you do a slow, quiet, like fogging a mirror exhale, and you make it really long, it's twice the length of your inhale, you can get little to no contraction of that rectus abdominis, so that when you're inhaling and the ribs go nice and wide, you can actually keep the ribs wide on the exhale. And so once you've created that, and most people will spend 1 to 3 weeks, like just on the basic inhale and exhale. So I want you guys to keep that in mind. If you go and watch the free video and you get to the apnea, and I believe I say this in the video too, you don't want to get to the apnea, which is the abdominal vacuum technique, or AKA Uddiyana Bandha, true Uddiyana Bandha, not how modern yoga teachers teach Uddiyana Bandha, which is exhale, draw the belly up and in. That's actually not true Uddiyana Bandha. True Uddiyana Bandha, as well as what low pressure fitness calls apnea, or both could be called the abdominal vacuum technique, both of them is a passive lift of a relaxed abdominal wall. A passive and relaxed being the key words, a passive lift of a relaxed abdominal wall. Okay, so when we get the ribs really wide like this, and then we learn how to exhale without that rectus abs pulling the ribs back in. So we learn how to inhale and exhale, keeping the ribs wide. And we learn how to exhale without that rectus abdominis kicking in. Then when we go to do, and it's at the bottom of the exhale, then we pause the breath and then open the ribs without taking air in. That's the apnea. Whenever we go to do the apnea, or that abdominal vacuum technique that creates this sort of suction or plunger effect, what happens is, because the ribs are wide, the diaphragm can lift, and then the abdominal contents can lift, and then the pelvic organs can lift, right? Uterus, bladder, prostate, so that the pelvic floor can become unweighted. And so that becomes like, it's one thing to do the breath work, but the postural cues on top of the breath work is what is low pressure fitness. And it's about, level 1 is like an 11 posture sequence that takes, depending on your breath ratio, it takes about 25 minutes that you would do like 3 times a week or like every other day to progress your own rehab, which is why I really love it too. Because it's like, you learn it and then you've got it, and then usually people, depending on their history of exercise, depending on their injuries, the severity of their symptoms, they 3, 6, 9, 12 months stay on level 1. And then once level 1 gets easy, they go to level 2. So I love it because it's kind of ends up being this like endless low pressure fitness system. Because once you get past level 1, that's all static postures. It's teaching your spine to be in neutral while turning on the deep core. And it's really learning the basics of the breath work and integrating all the postural cues, which just takes some time. But once you get past that, and that just becomes easy for your body, which it just does with repetition, it just takes repetition. You have to do it. And once you get to like level 2 and 3, then in my opinion, that's when it gets really fun. You start adding resistance bands and exercise balls and a breath trainer, to add resistance to your inhale, so it strengthens the diaphragm, and it's just adds more dynamic movement of the arms and the legs. There's more variations. But for level 1, which most people just stay on for that first like 6 to 12 months, I think I started level 2 at about 5 months, but I had to go to Barcelona to learn it. But people will stay on level 1 because it takes them, especially if you've been injured, it takes a while for your body to like, oh, this is what neutral is again, because we kind of lose our sense of proprioception, meaning like knowing where the body is in space without having to look at it, whenever we're injured. And so it's very much about learning spinal neutral, learning the basics of the breath work, and integrating the postural cues. And I can remember when I first learned it, I was like, it's a lot, it's like, oh, you grow tall, you reach your elbows wide, you neutral pelvis, there's all these things that you're doing. And at first it seems like a lot because your mind and body can only take in so much information at once, but you say you integrate 2 or 3 of the postural cues, the first time you practice. The next time you practice, you pick up 1 or 2 more, and it just gets easier as you stay with the practice. But that's really, really the key is just, you have to do it. You have to every other day do the practice. And then as well, if you have any core or pelvic floor dysfunction, taking away anything that would spike intra-abdominal pressure, which is going to be crunches, planks, supine leg lifts, double or single, running, and jumping. So all of those things would increase intra-abdominal pressure. And if any of you guys have a cough, a chronic cough, that's actually, coughing is like right up there with crunches as far as like, it's the most amount that increases intra-abdominal pressure. So if you have somebody with a pelvic floor dysfunction and they have a chronic cough, you want to get rid of that cough right away. And if you do have a cough, get yourself if you feel like you're going to cough and you have pelvic floor dysfunction, get yourself to where you're kind of like elbows on the counter or back of the couch, where you get yourself, 80, 90 degrees of your torso, so that you take gravity out of the picture. So then when you cough, you're not adding more force, more downward force to the pelvic floor. So, those are really key. Take out everything that increases intra-abdominal pressure while you're learning, until you don't have symptoms anymore, until you don't have symptoms anymore. So I think that's just a question. Is rowing an okay exercise? Well, that would depend, Edie, on like your specific, if you have pelvic floor dysfunction, just that like pushing and like pulling, you're definitely like, that's going to increase intra-abdominal pressure. So I would say just until you don't have any symptoms, you would just want to keep those exercises out that increase any intra-abdominal pressure. It's not to say you're never going to be able to get back to them, but just until you don't have any symptoms. But what is okay Swimming is amazing. Swimming is really good to get energy out whenever you have to kind of take away your normal amount of exercise. Swimming is really good. And then when you're walking, as often as you can, use the inhale and the exhale of this method while you're walking. Because we can walk in a certain way and hold our posture in a certain way and breathe in a certain way when we're walking. That definitely increases intra-abdominal pressure, you know? But if I'm growing tall and I'm like reaching a little wide through my elbows and I'm inhaling wide into my ribs and doing that slow, quiet exhale like I'm fogging a mirror, when I'm walking, I'm counterbalancing that pressure. Does that make sense?
Yes, it does. Are you?
Yeah, thank you.
Sorry, real quick. Are you going to show us a little teaser of? Can you show us your belly? It helps. I know you. Because, I think it's a good visual for people to see what like an exhale and rectus contracting looks like versus a relaxed rectus.
Yeah. Okay. Here we go. So if I'm get this out of the way, I'm going to stand and show you. Ooh. Okay. So I'm going to show you the exhale that you guys are all used to, which is going to pull the ribs in. So I'll do the inhale, which this is how you'll see it in the video. I have people come hands to the side, your knees are bent, your pelvis is neutral, and you inhale into the hands, not the belly. So the inhale looks very much like the apnea, actually. Like that. Okay, now if I exhale, you see, be able to see my mouth. Now if I exhale, like a normal exhale, just watch this area, okay? Wait. Can you see how it pulls my ribs together? And it even brings me into a little bit of a slump, right? If I even like creates like a little bit, what I used to have is like a 2-pack and a lower belly bulge, okay? And I'm a fairly thin person, but I had, because of all the traditional core work, this type of stuff, I had like a 2-pack and a lower belly bulge. You see this in a lot of women. They look fairly fit, but they have this like lower belly bulge. And that's what it reverses. So when you do this breath work, you'll start to get like this oblique line, because you're literally reshaping yourself from the inside out in the muscles that you're using from breathing. So now let me show you the exhale, that slow, quiet exhale, and just watch the difference. Watch how I can keep my ribs wide, okay? Can you guys see the difference? Pretty big difference, right?
Huge.
Right. So that takes time to be able to do that. I couldn't do this at all whenever I first started. Like it was like it was like, and I couldn't get up under my rib cage with my fingers. Like when I teach the online workshops and individual sessions, I teach people this upper abdominal massage for the diaphragm and the upper abdominals, because it really helps be able to expand the ribs, because this has been tight for so long. But just so you guys know, this was like super hard as a rock, like couldn't get underneath it when I first started at all. So I'll show you the apnea, just so you can the abdominal vacuum technique, you could say, just so you can see it in the body. But basically, apnea means no breath. Okay, so I'm going to inhale and exhale. It's 3 inhales and exhales. In this method, they call the inhale and exhale rest breathing, R-E-S-T. And then at the bottom of the 3rd exhale, you'll see me pause my breath. I'm going to for a split second, I'm just going to relax my abdominal wall even more. And then all I'm going to do, and it's really the only cue for apnea, all I'm going to do is open my ribs in the same way that I'm doing on the inhale, but I'm just not going to take any air in. Okay, so structurally, it's the same. That's why the inhale actually will look fairly similar here, like the apnea does. Okay, so I'll just show it to you. I'll do 2 rounds for you guys, but I'll just do 2 rest breaths just for the sake of time, and I'll show you the first rest breath, which I think I said in the video. You can do a nose plug with this to the first round, just to sort of get your body like, this is what it feels like to open the ribs without taking any air in, and then I'll just show you the second one without the nose plug. Okay. All right. So it looks like this. I'm going to do 2 rest breaths. Beginners, you're always going to do 3 rest breaths. Okay. I'm just doing it for the sake of time. Okay. So what you're going to look for, 4 things for the apnea that you know you're doing the apnea right, which is the lateral rib expansions. You have to have that. Okay. You're going to see a hollowing of my abdominal wall here. You'll even see a little hollowing above the collarbones because it also decreases thoracic pressure, thoracic cavity pressure. And you'll see a little tiny elevation of the belly button because ladies that still have your uterus, there's a ligamentous attachment from uterus to belly button. So we know with the exhale of this method and with the apnea, uterus and bladder are elevating, they're lifting, right? So you should see just a tiny little elevation of the navel point too. Okay. All right, here we go. I'm going to do like 3 count in, 6 count out is usually a good place to start. The other piece I just want to mention that's super important is reaching wide through your elbows. What that does is it turns on your serratus anterior. Your serratus anterior is a muscle that pulls your shoulder blades wide onto your back. So for those of you, especially if those of you who have been yogis for a long time and you were like me and you pulled you're like this, shoulder blades back and down, shoulder blades back and down. My level 1 teacher was like, you know, Summer, that's not neutral. And I was like, oh, like I didn't think of it that way. You know, it's actually not neutral for you to keep your shoulder blades pulled back and down all the time. And I realized for 20 years, I wasn't ever taking a full breath in, because you could do it right now while you're listening to me, pull your shoulder blades back and down and try to inhale wide into your rib cage. Can only go so far. And then do the opposite, which is reach through your elbows. Literally, like pretend like I have my hands on the outside of your elbows, push into them. You're going to feel serratus anterior contract, and then inhale. You're going to get much more rib expansion. And so that lateral rib cage expansion is huge for this, because if you don't have the lateral rib cage expansion, when you get to the exhale and the apnea, you're not going to have any room for things to lift. Okay. So I just wanted to speak to that piece. That's why you're going to see me doing this with my arms. I'm engaging serratus anterior. Okay. All right, here we go for the apnea. Okay, that's basically it in a nutshell.
Okay, time out. I want to hear from you guys, because remember when Dr. Summer was saying that most people in theory get this, and then when I'm sure you tried some of this while doing it. I want to know. I'm going to unmute you. How'd you do?
It's hard.
Very hard.
It's hard, and I think that it's going to take a lot of practice, and I'm curious. I did come to the call late, so I might have missed this, but how long of a process is it to teach your body, you know, to relearn this so that it is a natural thing, so that when I jump off the bed or I want to jump on a trampoline, I don't pee my pants anymore, and it is a natural, you know, that it's fixed. Is that even a possibility?
Okay, so there's like 3 questions in there. So the first is like 3 weeks it took me to learn how to exhale without contracting my rectus abdominis. And I'm a super body aware person. I've been a yogi for 20 plus years. You know, it's like, I was like pulling out my hair, like, why can't I do this? I was like, why is this so hard? You know, and it was just because I'd done the opposite, knit my ribs and drawn the belly up and in thousands and thousands of times. It's like, you just have to build those new neural pathways. The piece about, you have to remind me of the centered one, but the piece about like jumping on, oh, I know what I was gonna say. This is a rehab technique. So it's not that we're teaching the body this so that for the rest of your life, this is how you're going to breathe. This is a rehab technique to reverse core and pelvic floor dysfunction, to turn on the deep core again. So I'll give you an idea for me. At about a year, I started adding in, like when I started low pressure, I just took out my Kundalini yoga practice, my Hatha yoga practice. I stayed swimming, walking on the beach, like things like that. But I just took out because I really wanted to see what it would do to my body, because I could tell it was going to be so balancing, I could tell, for my body. And it took, like, at about a year, I started to add in, like, resistance training again, and kind of like my normal, like workouts. And what happens over time is that it's not that like you're going to do this, it's going to reverse the pressure and that pressure is never going to come back again. It's that when you do it long enough, like what I noticed for me is that instead of feeling pressure or heaviness here in the pelvic floor, I felt this lift of the diaphragm. So it literally, instead of here, it reverses that pressure, so you feel a lift here. So so it's not that you're going to do it once or for 3 months or something, and then it's never going to come back. It's that the pressure is never going to reverse. It's a way to counterbalance the intra-abdominal pressure, so that if you do things like running or CrossFit or, things that Pilates, or stuff like that you love, once all of your symptoms are gone, you're welcome to go back to it, and then keep low pressure as your balancing practice. Keep low pressure as, okay, if I want to do something that increases intra-abdominal pressure, which a lot of things increase pressure, this is going to reverse pressure, and it's also going to keep my deep core turned on for me the way I know it's meant to function. And so as long as you're doing that and you don't have any symptoms, like, you're welcome to do, whatever you like. And then as far as jumping on the trampoline, that's a tough one, like, because if you have symptoms, you just don't want to do it, and so because you're, until you get that, have reversed that pressure, bladder and uterus are more elevated, your pelvic floor and your transversus abdominis are all turning on the way they're supposed to function. It's probably not great that you try that, that's just, obviously it's so against gravity, right? Kind of like running. Yeah. Did I hit all your questions?
Yeah, I think so. Thank you.
Okay. Yeah.
Yeah, I too, I can, when I did summer's course, because I'm so trained to exhale and contract my core, it was so frustrating. I'm still unlearning it. But the great thing is, and I hope you guys aren't discouraged by something that's hard. In my experience, of things that are hard at the inset is because they are neurologically challenging, and that's where the true magic is with any sort of body transformation, is in working in this neurological zone. You guys know how passionate I am about MELT method. What's it doing? It's working on the sensory nervous system. It's working on getting you better alignment, getting you better communication, so that you don't have to think about it all day, because standing up and thinking about your posture is a futile pursuit. It just doesn't work. It's the 1% of the day you might think about it or be training. And what I really love about this hypopressive low pressure fitness is that it's really narrowing into that reflexive core. And it's so hard. And I guess that's just my personality. I'm sort of drawn to something that is challenging, and also reaps huge rewards, because even though I did it really poorly, my shoulders started feeling better within 2 weeks of doing, by the second week of your course. I remember emailing you and being like, I don't understand. My arms are so tight. I can't I can't relax my rectus on the exhale. My shoulders still felt better. So the nice thing is, even if you do it 25% right, you will reap some benefits from it, a lot of benefits from it, in my experience. So
yeah, and yeah, thanks for that, Stacy. And I feel also that, like, this is just so you guys understand, like, this is an hour talking about it, giving you the synopsis of the concept and the theory behind it and the why, right? But to really learn it, like, and I teach people individually for Zoom, but do these 4-week online courses so that we meet once a week for 4 weeks, and we do a lot of Q&A, you know, and we do, you learn the abdominal massage, you know, you learn the release of the diaphragm techniques that precede the practice. So you get up in the morning, you do your 10-minute, 15-minute, no, so it's like 10-minute, less than 10-minute abdominal massage, so that when you go into the breath work, that you're actually have released what is generally pulling your ribs in. So that's super helpful. I did that like 5 days a week for like 6 months. And now I only have to do abdominal massage like once every 2 weeks. You know, maybe I'll do it. If the other piece is the nervous system piece that you sparked when you said that, Stacy. When you're doing just the basic inhale and exhale, and this is really where they're going with the research of this method now, is how it affects stress and anxiety. Because the basic inhale and exhale of the rest breathing, because the exhale is twice as long as the inhale, that activates parasympathetic nervous system, your rest and repair mode, or rest and digest mode, they call it. So you'd be welcome to, if you were just rest breathing, you could do that in the morning, you can do that in the evening, you know, as much as you want. When you add in the apnea, the abdominal vacuum technique to the practice, that, you know, you're doing the hypopressive breathing for, let's say, 20, 25 minutes at a time. Whenever you add in the apnea works to actively, you're consciously working with your sympathetic nervous system. And that's because at the bottom of that third exhale, you pause your breath, and you're holding your breath as you open the ribs and get that suction, or that vacuum, or the apnea. And when that's happening, oxygen's decreasing, CO2 is going up. And so that's a trigger for the body to be like, like I need air. Like the sympathetic nervous system is like, I gotta get air. And so that's why we start with like maybe a 3 to 5 second hold on the apnea, so that you're consciously working with, how long can I hold this, so that on the inhale, I can actually control that the next inhale is going to be in my rib cage and not my belly. Because if you hold it for so long, so much that your body goes into a quick little panic, like, I need air, it's just you're going to inhale into the belly, you're going to inhale using your neck muscles, you know, you're going to inhale everywhere because your body just needs air. So there's a very specific way you work with it. And with apnea, it boosts your metabolism. It can boost energy. It was one of the first things I started noticing, was like, wow, I actually just have more energy from doing this. And that's just straight from getting more oxygen, you know, with the breath work and the amount of the rib cage expansion and all that stuff. And so I just wanted to speak to that. That's why it's actually, the practice is very balancing for both sides of the nervous system. It's a great time after like your low pressure practice to like go into meditation, because your nervous system's going to be more calm, you're more balanced, and your mind's going to be more calm. So that's a huge plus. And I'll just stop there in case there's any comments or questions. Or
I like Lisa's question here in the chat. Is this a problem for women? And I think you sort of touched on that. But
men, it'll show up more as hernias and disc herniations, or and men can have issues with incontinence as well, and also erectile dysfunction. In women, the sexual dysfunction shows up as like inability or having a hard time getting to climax or orgasm, because with that you need your pelvic floor needs to fully relax and fully contract. I had a woman once, a friend of mine in Pensacola, Florida, that took the course, and she hadn't had an orgasm in years, like close to 10 years. It was like a lot. And 1 month after doing the method, she said she started having orgasms again. And I was like, yes! I was like, this is amazing, you know? And, but you know, when I get men that come to the workshops, men don't come to the workshops saying, I have erectile dysfunction, as you can imagine. They say, I have hernia, you know, or like I've worked with a couple people. The men that I've worked with, especially with online clients, it's hernias. And I mean, I actually have one right now where he's like, I have premature ejaculation. Like, can this help with that? You know, but he also has a hernia. And the reason it works it's the only thing I know actually that heals hernias and diastasis recti is because there's a component of low pressure fitness that is like you're growing tall through the crown of your head, which is called axial extension. And there's this eccentric strengthening component, which means you're lengthening your muscles while contracting them.
And that's what heals tears in the tissue, like with hernias or diastasis recti. So like, to say it another way, if any of you guys have ever had like a tendonitis or something where there's micro tears in the tissue, if you go to physical therapy, they're going to give you eccentric strengthening exercises, right? So it's like if you're doing, let's say you have, I'm trying to think of an easy example. Let's say you have a Achilles tendonitis, right? And the eccentric exercise is going to be when you're, the concentric would be when you push into your toes and raise your heel, but the lowering down where the muscle's lengthening and contracting is the eccentric component. And so there's this eccentric component of low pressure fitness, which is why it heals the tears and things like hernia and diastasis recti. The other piece I just want to mention, an intention you could say of low pressure fitness is myofascial stretching. And so, and this is what we go over in the workshop. I don't go over it too much in the free videos because that's really just going over the basic of the breath work. But the myofascial stretching, so if you reach, and you can feel it when you do it right here, do it with me, just reach through your elbows, pretend like I have my hands on either side of your elbow, and then push your elbows wide into your imaginary hands, and then reach your fingertips towards the floor, and then grow tall through the crown of your head like you're peeking over a fence. You're gonna feel some like myofascial tension, right? So it's gonna show you very quickly where you're tight. And you don't have to do this 100% of your effort. I always actually tell people do it 50% of your effort so it doesn't feel so rigid, you know, just enough to engage that serratus, just enough to grow taller, just enough to reach through your fingertips, you know? So it shows you very quickly where you're tight. So, so like, for example, any of you had neck injuries, whiplash, shoulder injuries, rotator cuff stuff, you start getting into these postural cues, it adds, there's this like low level of sustained tension or stretch on the myofascial tissue. And that's actually what fascia or your connective tissue needs to stretch. You need 2+ minutes to stretch fascia. Muscle is like 30 seconds, but to really stretch connective tissue, you need 2+ minutes. And so if you think like if you've had an injury, let's say you strain your neck, your body lays down scar tissue and often lays it down in this sort of haphazard way. It lays down a lot of it, in other words. And instead of your connective tissue, your fascia gliding like this, it's like this now. And then you reach through the elbow, so it adds this starts to add a little stretch over time. And you're doing a practice that's 20, 25 minutes, you know, every other day. That's for 20, 25 minutes, you're stretching that fascia, you know, you're gonna get this like reorganization of your fascial system, which is another just like really cool piece. And so it's like, postural reeducation, yes. Respiratory improvement, yes. Sexual enhancement, yes. Waistline reduction, yes. And then pelvic floor restoration. So it's like this like very complete system. Is why I've gotten so behind it.
Who doesn't love that?
Right.
I have another private question here. I'm wondering about an imbalance of how much the two sides of the ribs are able to expand. And also if it's normal for the abs to feel like they're contracting on the exhale. I mean, I think it's
totally normal because your exhale, your rectus abdominis helps you exhale. That's what, but in this rehab technique, you're tweaking the exhale so it's a slow, quiet exhale, like you're fogging a mirror. So you that rectus abdominis is like little to no contraction. What was the first piece, Stace? Can you repeat the first part of that?
I'm not sure. It's really kind of referring to balance.
I remember
of the
right
rib.
after I asked the rib cage expansion. The best way to answer that, because everyone's the amount of tightness here is so different, and depending on your history of exercise, your history of injury, the severity of your symptoms, how tight you are right there. What I would say, if there was a normal, you could say that, that first like joint of your finger, whenever you, like, and I teach this in individual sessions and in the 4-week online course, if you can get like the first joint of your finger, like up under your rib cage, that would be considered normal. This again, wasn't even close to happening when I started. It was literally like this. Like that's what it looked like when I first started. I was so tight. So that I would go more with like, how much can I get underneath the rib cage and how supple and soft can my rectus abdominis be? Because when you do the apnea and you're doing that abdominal vacuum technique, you could literally take a hand and this should be soft. So let me do it real quick. That should be soft versus hard. You see what I'm saying? So you can literally take a hand and kind of feel it in yourself. So the amount your particular rib cage is going to expand, it's going to depend on that myofascial mobility in your diaphragm and your abdominal wall, your rib mobility, your spinal mobility, what your posture like there's just so many factors. So I feel like that's maybe a better way to answer that question.
How is the psoas implicated in all of this? How does
Oh,
that?
good question. Yeah, no, great question. So the psoas, the hip flexor, has fascial attachments all the way up to the diaphragm. And so, and also, so as your hip flexor connects to the lumbar spine, the several segments of your lumbar spine vertebrae, right? So whenever we're doing apnea, and even exhale, like on if you do this exhale correctly, you're still getting elevation of organs and pelvic floor, right? Like it's just that the apnea is like the exhale on steroids in a way. It's just more powerful. Let's see. Tell me your question again, Stace.
Psoas.
So thank you. The fascial attachments of the psoas like come up to the diaphragm. So if you think about elevation of rib cage are wide, the reason the rib cage is wide so that the diaphragm can elevate. The diaphragms elevate and the psoas has fascial attachments to the diaphragm, then the psoas is going to lengthen. Psoas connects to lumbar spine, it's going to decompress the lumbar spine.
So anyone listening to this with lumbar issues, I hope that resonated with you. I hope you guys can understand that, breathing, this is really the source of so many of our issues. And I think that's really the point that we've done. And I think it's so helpful. Just thank you for showing us your body, because it really, for us visual learners, it really helps to understand some of the techniques and things learn, in depth, in the course, if that's something that interests you guys. So if you guys have questions, please unmute yourself and feel free to ask Dr. Summer anything.
Yeah. Oh, good, Gina. Gina, that really helped her with the issues. Good.
Oh yeah, sorry, I could have just said it. Yeah, thank you.
Yeah.
And I just want to say, for those of you I don't know, which is really nice, there's so many of you that I don't know, please email me. I'm going to write this in the chat, info@Fisher Fitness. If you don't get emails regularly from me, because when I send out the Fisher Fitness, the recording, I need your email to send that recording. I just send it to people who I've initially emailed. In addition, I'm also going to Dr. Summer's workshop invitation here. Maybe.
And it's discounted right now just because of the pandemic. So it's usually $222 and right now it's $99, just so you guys know.
That's an insane deal. And selfishly, you guys, I had Dr. Summer on because I desperately need to get back into this practice because it works. And so this is just a really great way to review the why this is so important. And so I put that link in the chat, and then I'll also, again, if you email me info@Fisher Fitness, then you'll get the recording, and I'll put that link in there as well. So are there any other questions?
I have a question, Stacy, or actually for Dr. Summer, but should you be feeling like you're like holding your ribs out when you're doing the slow breath, like trying to, because I feel like I'm sort of forcing them into that, staying in that expansion.
On the exhale, you mean, should they stay? Right. Yeah, that's your goal. but just know it's probably not going to happen at first. Okay.
Okay. So they move in and that's sort of normal in the beginning. Yeah.
Exactly. Yeah. Because your belly, your rectus abdominis is used to doing this for you. It's used to doing that. And so it's a retraining. And so know that that's your goal, but it's probably not going to happen until maybe 2 to 3 weeks. And but in the free video that you guys will get, yeah, I'm almost positive in that video. This is what I had to do for 6 weeks, y'all. Like I had to use my hands. I'd inhale, hold my ribs wide, just a gentle overpressure doing this, so that when I would exhale, it would give my body the feedback of, this is what it feels like to hold your ribs wide when you exhale, because my body was so used to knitting the ribs and bracing the abdominals. So that's huge, like to just give that manual feedback, still reaching wide through your elbows, still engaging serratus, all of that stuff. But just to give that feedback is really helpful, because you're literally trying to teach your body something it's probably never done, unless you've learned like true Uddiyana Bandha in yoga before.
That's super helpful, holding the ribs out. Thank you.
Mm-hmm. Yeah. And it's in that video. So you guys should see that. And I really did for the first 6 weeks. In every posture that I could, I used that. And for usually people will use that nose plug too for like a week or two. Some people don't need it at all, but some people it's really helpful to give your body the feedback of like, oh, okay, that apnea is exactly like your inhale with as far as the ribs expanding, but you're just not taking any air in. Oh, good. Okay, Gina's saying she can feel the tension along the spine that needs to release. Good, yeah. And that's piece too, is that you guys, we're all tight in different areas, right? Like depending on where we've been injured and that type of thing. So you might feel more like, whoa, it feels so tight, like my upper traps, or maybe it's between your shoulder blades, or maybe it's in your back, or maybe it's down your arms if you're a manual therapist or a body worker of some, like me, of so many years. I was just like, oh, I could just feel it down my entire fascial line down my arm. I kept asking my level 1 teacher, is this okay? Like, I just feel so much tension, And she's like, just stick with it, And so I did, but like the way I teach it is like, kind of like how I teach yoga. It's like a relaxed effort, like just enough. Like, don't be like, ooh, like so tight and tense, like just enough, to add those postural cues. Any other questions?
All right.
Let me speak to one other thing that just popped into my mind that I found really interesting when doing this, Stacy, was that, and I don't think we touched on it, was that like what makes a diaphragm tight? And it can be just from doing a ton of, traditional core work, and the rectus is tight and the ribs are tight and the spine doesn't move well. It can be all of that stuff, obesity, it could be that. But there's this piece, because I was so much into the emotional side of things, I mean, I still am, that I kind of like had an aha moment when I started doing this work, was because if you think about how many of us have had some form of childhood trauma, even if it's not like trauma with a capital T, maybe it's diffuse complex trauma, like throughout your childhood, and you learned to hold, this tension in your solar plexus, which is your seat of power, your seat of self-worth and self-esteem. And you learn to kind of hold, even if it was just a low level of tension, and a low level of like fight or flight. Maybe you were hypervigilant because of your circumstances as a child, right? That puts that diaphragm and that breathing pattern, your nervous system, in that overstimulated, hypervigilant fight or flight mode, And so when I started doing this work, I was just like, oh, like I can do all the friggin' emotional processing I want, but if I don't actually change the physiological way that like my body breathes itself, and the amount of air and movement on my diaphragm, that like physiological pattern, that's almost like the residual residue of trauma like stays stuck in the body. And so I've actually had quite a number of clients have a emotion come up, and when they start doing the abdominal massage and they start really like making room and like space in this area, because it really very much is about making space in the body. So I just wanted to speak to that, because that really spoke to me. And it's not like one of my teachers taught me that. That's just more from from me in my background and kind of like really taking on the practice and learning it. But you know, and the reason you guys haven't heard of this is, and I don't know if I spoke to this, that low pressure fitness started in Spain by Tamara Real and Petey Pensac. And they're exercise physiologists, and spreading it all over Spain, right? And then they hit the Spanish-speaking countries, right? Like, so South America, Mexico. So it's like and I think it's pretty slow, actually, like their implementation in the US. It's coming, you know, a little bit. There's like one teacher in Canada. It's coming, but it's not really here yet because it started in Spain. Like their website, if you just look it up, it's going to be in Spanish, but I think there is one in English if you can kind of search for it. But it's not necessarily the easiest thing. You know, it's like they have online stuff, but it's in Spanish. And so it's like, it just hasn't really made it like to the US. Yeah, I think I was told at a couple years or year and a half ago, I was like one of 50 teachers like in the United States. And I was like, wow, I really feel like it was like a big kind of like gift that landed in my lap, you know, like to be able to share and spread this, because so many people, and my mom included, like so many people are suffering from this. And so many people are told to do Kegels and no idea that that's actually what makes it worse. Or they want to take out their, you know, they want to take out their uterus. God, please don't ever, if you don't have to, like that would be the last resort, like that you would want to do. The uterus has 7 different ligamentous attachments to pubic bone, sacrum, belly button, like all these. So you cut the uterus and then the bladder's going to fall, you know? So, so maybe some of you, if you've had a hysterectomy, you've experienced that. I know my mom has. So yeah, I just wanted to speak to that. It's just like, if you can avoid surgery at all costs, you know, this can reverse grade 1-2 prolapse. With grade 3-4, if there's been like tear in the tissue, oftentimes you still might have to have surgery, but low pressure is going to be your pre and post-op rehab, you know, because that's actually getting to the root of why you had it in the first place.
Would this be good for somebody? I have a stepmother who had the prolapse surgery like maybe 10 years ago.
Mm-hmm.
Would this be a good thing for her to do to prevent any further damage?
Absolutely. Yeah, so she doesn't end up like my mom having to have a second, like she had everything, uterus, bladder, prolapse, everything, everything dropped, and she had it all slung up there or whatever, like 10 plus years ago. And now she's having to do it again. Rectum is prolapsed, bladder is prolapsed. She's having to do it again. And she's been to my workshops. I was like, Mom, have you been doing it? And she's like, no. I'm like, like literally your daughter like has the medicine for you and you're not doing it, you know. Anyway, it's like beside the point. But yeah, yes, absolutely. Like it should be, I personally believe it should be standard of care for postpartum women, but even for mamas like 10, 20, 30 years later, still so good to do, you know. And like I'm using it to like prepare my body for pregnancy. And actually my level 1 teacher is pregnant right now, so I'm really interested to see how she births the baby, because she went into this whole thing of how if you do the inhale and exhale of this method, the exhale elevates uterus, elevation of uterus facilitates uterus contraction. So can we breathe the baby out and not actually have to bear down and push, you know? So that's exciting for me, because I'm like, I'm definitely trying that way, you know?
I got into this about 1 year postpartum, and my initial thought was, man, I should have done this a year before I got pregnant and all throughout my pregnancy. It just was like, wow, this would have created so much space, would have created the balance I needed. And it's okay, you know, hindsight's 2020, and I'm so happy for you and for all of us to you know, be pelvic floor pioneers, you know, be ahead of the curve. And
yeah, it's like tell all the women you know that there's actually a method that is effective for this. That's what I feel like. I'm like, any woman that can be a messenger for the women is just, it's just like so needed, you know?
So needed, in the fact that pelvic floor PT is so hard to find anyways these days. You know, it really should be standard of care before, during, and after pregnancy and beyond, you know, particularly if you've had a surgery or a birth injury of any kind. So
yeah, and I'm not even specifically a pelvic floor physical therapist, y'all. Like I just have taken all of like the low pressure classes and learned from my pelvic floor PT friend who's 15 plus years, and she literally told me, she was just like, I literally give all my pelvic floor patients low pressure fitness, and it helps all of them. It's like, no matter what the case is, you know, like if, as long as it's not like a grade 3, like even with a grade 3-4 prolapse, you know, like I'm going to give them, this is going to be their pre-surgery, post-surgery stuff. So I was just like, oh, awesome. You know, so I don't do like internal pelvic floor exams or anything like that, but I'm a big believer in, like, you know, if you need trigger point release, like go see a pelvic floor physical therapist for the internal work can be really helpful. And if you guys can tell when you start doing this work, if you do the online workshop and stuff and start doing the postures where you're tight, then you take, you can go to, I really love rolfing. I think it's like the best style of body work, is deep fascial work. Go to your rolfer and be like, this is the exact line that feels tight on me. And then they can work that deep fascial line. And then it just like fast tracks your progress.
That's right. Yeah, I just love the combination. I think that this method is honestly appropriate for everyone, and so I am so thankful that you could be with us. I think we all want to be where you are in Kauai. It looks so nice there. Place to be stuck. Are there any more questions before we wrap up for today?
Yeah, go
I
ahead.
have a question. Hi. I guess I missed the whole thing. I'm sorry. I thought it was from 1 to 2. So it sounds like I'm in the right place. I have a 4-year-old daughter, and I was pretty smooth sailing until after I stopped breastfeeding, about 3, and I just started having like tremendous bladder pain on and off, on and off. And it's just been with me. I've seen a few people for it, but and you were talking about preparing for pregnancy, and I want to get pregnant again, but I'm so scared because I hurt so bad down there. So is this is the right class for me?
Oh, absolutely. Yeah.
Yeah.
If you had your first baby, that you should use it as your postpartum rehab, but then your getting pregnant with your second baby work, you know?
Yes.
Absolutely. If you had a diastasis, it will heal it. If things are sitting too low, it will elevate. It'll turn on your deep core again. Absolutely, I really should be like standard of care. And
Okay.
if you have the bladder stuff, I mean, I would say work with a naturopath, make sure it's not any type of infection or something like that. And then, you know, for peace of mind, you may want to see a PT and see if there's any trigger point release stuff that they could do. That
Okay.
might help that as well.
Okay. And then how do we sign up? Is that the email that she gave us?
Yeah, so I think this is Jenna.
Yes.
Chat, you'll see my email. It's info@fisherfitness.com, because
Yes.
I don't know if I know you. Go ahead and email me, and then I'll
Okay.
recording since you missed it, and then
Okay.
there'll also be the sign up for Summer's 4-week class.
Okay. Thank you so much.
Mm-hmm. And also too, I just wanted to speak to you because you brought up the pregnancy. I remember 2 years ago, she was like, if you were to get pregnant right now, Summer, like before all the benefits of this work kicked in, and I was so tight, she's like, you're so tight from here to here that the baby would sit lower. You'd probably get a diastasis, and then you'd be at high risk for prolapse. And I was like, I'll be your best student. Just tell me what to do.
Yeah. Yeah. And is 4 weeks enough, or is this something that we'll learn from you and then just do all the time on our own?
The second. Yeah.
Okay. Okay.
The 4 weeks is like, it's enough we usually get through in the 4 weeks about 7 of the 11 postures, but I also teach you the abdominal massage to start doing and all of that stuff. So it's still a lot in 4 weeks, is what I'm going to say. But normally I'll check in with people a month later and be like, okay, who's ready to learn the rest of the level 1 sequence? And I'm still waiting for there to be enough people to like go to level 2.
Okay. Great.
Yeah.
Are there any other questions? Okay, you guys. Well, thank you so much. Thank you, Dr. Summer Nicole Radina, and have a great weekend, everyone. And we'll see you soon.
Thank you.
Thank you.
Thank you. Bye.
Thank you. This was awesome.